Hi, my name is Marie. I work in reception and registration here at the ASC, and I work to make your environment warm and welcoming for you. So I'll be the first person that you see when you come in. I think you'll be very comfortable in our organization. When I hired on here, I didn't realize what a fine group of physicians I would be working for, and also the nursing staff and everyone else that helps to make this environment a great place. So welcome to our facility.
Hello, I'm Dr. Alan Ayer. I'm the medical director of the Ambulatory Surgical Center of Stevens Point. As medical director, I'm responsible to make sure all the procedures done in this facility are done very smoothly, effectively, and safely. We do a variety of anesthetics, including general anesthesia, spinal anesthetics, a variety of block anesthetics so that it renders a part of the body numb so the surgery can be performed. We also provide blocks for post-operative pain relief. Very often a patient has had a surgical procedure and goes home in a fairly comfortable condition. We handpicked all our staff from the local hospital, and all of them agreed to come and perform their job at the surgical center. Other procedures that I personally do at the surgical center have to do with chronic pain relief. My specialty is doing various injections for lower back pain and leg pain, the so-called sciatica and lower back pain. The surgical center is also much more efficient than a hospital setting. So what that means to you is that you'll spend less time here and you're able to recover at home where it's much more comfortable for you. The things we strive for in care for our patients is that we make them as comfortable as possible. We explain everything beforehand so the procedure is much more comfortable to them, and we use the skill we were trained to do to make this stay a more pleasant one. Should you need a surgical procedure in the future, we would hope that you would consider the Ambulatory Surgical Center of Stevens Point so that we can show you our skill, care, and comfort beyond your expectations.
I'm Dr. Jim Banovitz. I'm an orthopedic surgeon here at the Klaczynski Clinic in Stevens Point, and I do much of my surgery at the Ambulatory Surgery Center of Stevens Point. I'm board certified in both orthopedic surgery and in sports medicine, and I also have a PhD in motor control neurophysiology. So my focus is repairing joints and helping people get better and be able to move and do the things that they want to do. In talking about the Ambulatory Surgery Center, I'd like to talk about our philosophy and the way that we approach patient care. We like to say that we provide skill, care, and comfort beyond your expectations. And that starts with skill, and we've really made an effort to go out and find both physicians and support staff that are the most skilled people in this area that can really provide our patients with a top-notch level of care. So finding those skilled people, recruiting them, and bringing them here is very important to our mission of patient care. Here at the ASC in Stevens Point, our operation is locally owned and operated. We're a small business located here in the community. We have no overseers in some other place that are telling us what to do. So like your old-time physician, our only motivation is to take the best care of you that we possibly can. If we provide that kind of care for you, then we know that you'll come back and you'll send family and friends back. And of course, that's the goal of all healthcare organizations, but because this is our own little small business, everybody here has that kind of motivation. And we're not worried about responding to some executives that are sending us down commands from on high. And I think that's very important. That's the big corporate style is what people are used to. We're providing a higher level. And that's why we feel that our skill, care, and comfort will be beyond your expectations.
My name's John Fuller. I'm a board-certified urologic surgeon. Been in the community for 16 years. Vast majority of my operative cases are done as outpatient procedures, and just want to let you know a little bit about what we do at the Ambulatory Surgery Center. We do both adult and pediatric cases. Probably the majority of the cases that I do revolve around kidney stones and urologic stone disease. We do a fair amount of surgical procedures for cancers of the bladder. We do some incontinence surgery, and we do a fair amount of pediatric surgery for various urologic conditions. We've been fortunate to basically be able to handpick the best nursing staff in the community for our ambulatory surgery center. It wasn't difficult to find motivated and talented people to come help us in running and managing the ambulatory surgery center.
Hi, my name is Dr. Matthew Hattenhauer. I'm an eye physician and surgeon with the Eye Clinic of Wisconsin. Multiple offices in the central Wisconsin area. I practice predominantly in Wausau, as well as Stevens Point, Antigo, Medford, and Rhinelander. As an ophthalmologist, I specialize in both cataract and glaucoma surgery, as well as medical ophthalmology. In the Stevens Point area, we perform all of our outpatient surgery here at the Klaczynski Ambulatory Surgery Center. All of our patients undergo surgical procedures that are generally less than an hour in length. They're all geared towards outpatient surgery, and the surgery center is an ideal location for that, for those situations. At a surgery center, patients perceive it more as a procedure versus an operation. They're steps away from the door in a very caring and compassionate environment. The staff here is excellent at both patient care and comfort, and as well as making it efficient for the surgeons, period. In an environment of ever-increasing healthcare costs, ambulatory surgery centers not only provide excellent care, they also can provide it in a more cost-effective method to both the patient as well as the provider and to Medicare, which provides a significant portion of reimbursement for healthcare in this country. The technology that's afforded, that we have here to use is the state-of-the-art technology for all the procedures that we do. Cataract surgery is probably the largest volume procedure that we do at an ambulatory surgery center, and the equipment that we use is state-of-the-art, allowing us to provide cataract surgery to patients with complete comfort and in generally a short amount of time, less than 15 minutes for almost all cases. Because it's a newer facility, not only is the equipment state-of-the-art, but also post-op and pre-op recovery areas to ensure patient comfort throughout their stay here. I think the staff here was selected and picked really because of their experience in an outpatient ambulatory environment. They're all accredited with their nursing degrees, medical degrees, and have a wealth of experience and knowledge appropriate for patient care.
My name is Dave Hennigan. I'm an orthopedic surgeon. I practice at the Klaczynski Clinic. My I'm a general orthopedic surgeon, and my special interests are joint replacements, hip and knee replacements, and that sort of thing. Here at the Ambulatory Surgery Center, I do a variety of orthopedic procedures. Among them would be arthroscopy of the knee, carpal tunnel surgery, some shoulder surgery, and more recently we've started doing some joint replacements, in particular the knee. I have an interest in both total knee replacement and partial knee replacement. I have been doing total knee replacements for 25 years. Partial knee replacements are a more recent interest that I've been doing for about 4 years or so. The advantage of the partial knee replacement is that in people who have good indications for it, people can go home very shortly after surgery, often even the day of surgery, and can resume normal activities very quickly. People tend to get a very good range of motion and very good pain control after that procedure. In addition, we've recently started doing a small number of total knee replacements here at the surgery center. Most of those people will stay overnight and go home the following morning. We've had some very good success with that. I enjoy working at the surgery center. The staff is excellent, very highly skilled. They're people we've been working with for many years, but they tend to have a very nice attitude. It's a very friendly place to work. They take very good care of my patients, and I get a lot of feedback from my patients after their surgery saying how everybody had a wonderful attitude, and they really enjoy their experience here. And so it really has been a fun place to practice.
My name is Dr. Matthew Reardon. I began practicing here at the Klesinski Clinic in 1992, and in 2006 we began performing surgeries at the Ambulatory Surgical Center of Stevens Point, here adjacent to our clinic in the Klesinski Medical Complex. Dr. John Fuller is an associate who has a urology clinic affiliated. We also have on-site physical therapy and a neurology practice that is run by Dr. Michelle Klesinski, the daughter of Dr. C.A. Klesinski, who founded our orthopedic clinic. Orthopedic surgery is the medical specialty that operates on bones and joints, from spine surgery to fingernail, toenail surgery. We perform bunion surgery, ankle arthroscopy, corrective surgeries of the foot. We perform hip and knee replacement as well as shoulder replacement. A new service at the Ambulatory Surgical Center starting this year was the development of an outpatient knee replacement program. To date, we have performed 3 knee replacements, and all the patients are doing very well. We have no infections. The patients have regained a better range of motion and pain relief than they had prior to the surgery. We think outpatient knee replacement will someday become the standard of care, and we believe this center is one of the 5 to 10 centers in the state of Wisconsin which can help lead us into the future. Typical surgeries performed by an orthopod include carpal tunnel release. We do a lot of shoulder surgery here as well. People have a condition, typically develop a condition with aging that's called impingement. Impingement is where the bone in the top of the shoulder impinges upon the rotator cuff, which glides underneath it. This rubbing tends to irritate the rotator cuff muscles. The rotator cuff muscles then can become frayed or degenerated because of the squeezing that occurs. The nutritional supply to the tendon is impaired, and the tendon goes on to either tear because of mechanical reasons or tear because of nutritional reasons. The surgery designed at decompressing the tendon is oftentimes called an acromioplasty. Oftentimes it is combined with removal of the end of the collarbone. All this is designed to make more room for the rotator cuff, reduce the amount of physical or mechanical rubbing that occurs on the tendon, and also improves the nutritional inflow of blood to that tendon so that it can heal. The surgical and medical equipment at this facility is top-notch. I operate at several other hospitals, and our equipment here is at least of that quality, or in most cases, it's better, newer, and more state-of-the-art. You'll find the ambulatory surgical center is efficient. We believe efficiency is important in healthcare in that resources are not wasted. Your time is an important resource when it comes to delivering healthcare. Surgical procedures performed at the surgery center typically involve a half an hour to 45 minutes of preoperative assessment and getting to know one another. We ask you about medical conditions and how you're feeling, of course, and do a detailed review of your medical status. Consider the Ambulatory Surgical Center for your next outpatient surgery.
My name is Becky Ziegler-Otis, and I'm the administrator of the Ambulatory Surgical Center at Stevens Point. We perform a variety of procedures at the Ambulatory Surgical Center at Stevens Point. We're a multi-specialty surgical center. We cover the different specialties of orthopedics, pain management, general surgery, urology, ophthalmology, and podiatry. I believe we meet our tagline, which is skill, care, and comfort beyond your expectations. We also provide great care as it relates to a national patient safety standard, as it relates to making sure we have the proper patient. You'll hear continuously at our facility someone asking to make sure that we have the name and verifying the birth date, all to make sure that we have the right patient so that no mistakes are made in the care that we provide. Another area related to care is the waiting room and the comfort that you provide in the waiting room. Not only do we take care of the patients, we take care of the visitors and the relatives that come along with the patients. We try to make our waiting room as warm and inviting as possible. We take care of them by providing them with cookies, soda, coffee, anything to make their needs met while they're here. We also pay careful attention to make sure we keep them informed about their loved ones on where they are within their surgical procedure.
Hi, my name is Betty Strike, and I have been a registered nurse for over 16 years. I have been employed at the Ambulatory Surgical Center since we opened in 2006. I recently had an experience with my daughter that required surgery, and we chose the Ambulatory Surgical Center for our surgery. She had knee surgery, and I just wanted to let you know, from the check-in to the pre-op to the operating time, post-op, everything was handled in a very professional manner. My daughter was very pleased with her experience as a patient. She had had surgery in the past, but not anything this big, and for having surgery, it was a very pleasant experience. And we did have a choice where to go, and now I'm sure that we made the right decision. When I was here with my daughter, I'm so used to being a nurse, and I told the staff that I am a mother today, and they treated me as if I did not have any medical experience. Everybody gave us great opportunities for questions, answered all of our needs. So overall, with the experience with my daughter, I would have to say that we experienced skill, care, and comfort beyond our expectations.
Hi, my name's Jody Hansen, and I'm a registered nurse, and I work at the Ambulatory Surgical Center, Stevens Point. I have 33 years of nursing experience, and most of my experience has been in hospital settings. When I came to work here, I felt almost honored that I got to come work in a facility like this. I know that I'm working with a medical group that's very touchable and very approachable, and it's nice to work with doctors who care about us and care about their patients. We strive to give the best care that we can to meet people's needs. We want them to feel comfortable. We want them to feel like they're more in a home environment while they're here. This is a place where we want it to be less stressful for people to come and avoid all the busyness of going to a bigger hospital to have something done. And I've, in fact, even had my son come as a patient because I feel that good about having the doctors work on my family. And this is a wonderful place to work. It's a wonderful place to have in Stevens Point where people have a choice of places that they want to come to and places that their doctors are providing care. I'm glad that I work at a place where compassion and caring is the most important thing, and we want to take the best care of people and make them feel the best, and our doctors are very involved in that decision to do the best we can for the patients that come here, and we consider them all friends when they're here and take care of them as if they were our own family. It's a wonderful place to come, and it's a wonderful place to work, and I'm very glad that I get to work here.
We're Gary and Ann Glock from Plover, Wisconsin, and we have been to the Ambulatory Surgical Center of Stevens Point numerous times, and always have many, many compliments for them. They do a very personal job. Dr. Alanea has been outstanding in his work with both my husband and myself, and everyone in the office, is from the receptionists with the warm cookies to the nurses to the people putting in the IVs, just an outstanding job. Have a choice of lunches when we're finished with the procedure, and in most of the cases we came in pain and left totally pain-free.
I'm Ronnie Check. I'm about 68 and a half years old now, and I was born in Milwaukee, and when I was 2 years old we moved here to this area, and I've lived here all my life, and been working constantly and got myself kind of beat up in different occasions. You know, I had an elbow fixed, knee fixed, and I always came to see Dr. Reardon whenever possible. He has a good reputation and he's done excellent work for me, and I've been happy with everything I've had done here. They treat you like family and make you feel real comfortable, so that's why I keep coming back here. The other thing that was really important to me too was, you know, you're working with hometown people, and once again they treat you like family, and you don't have to drive far, and the traffic and everything else. Yeah, the staff, you get to kind of know them one-on-one, and they just treat you so good. They're so caring that you don't seem to experience in the bigger locations, or if the people you're unfamiliar with, you're pretty much a number. Where here, it's really nice. They call you by first name and smile, and You know, surgery is not fun by any stretch of imagination, but these people here make it so much more tolerable by their friendliness and caring attitude.
Hi, my name is Paul Hintz. I had a total knee construction surgery done here at the ambulatory center. The experience was wonderful. Prior to my surgery, the head nurse walked me through the building, told me where I was going to start from, what was going to happen there. She then took me to the general area where the procedure was going to be done, and then from there took me to where I was going to be doing my recovery. I did stay overnight. The services that I received through the staff were, bar none, the best service I've ever had. They took care of everything that I needed throughout the night. When I needed a lamp to be able to read with, they were kind enough to either go into the lobby or one of the offices here and get a lamp so that I could have it next to me to be able to read. They did come in when they needed to take my blood pressure and vital signs and things like that, but otherwise they left me so that I could get the rest I needed. But then when I did wake up, they would come in and check on me. The anesthesiologist, along with the individual that put the intravenous into me, they walked me through the whole thing, and the young man that did put the intravenous connections into me, he was done while I was talking to the anesthesiologist and never even felt it going in. Dr. Reardon and his staff were very thorough in explaining what was going to happen, what my recovery time was going to be, taking care of setting up in-house nurse to come into my own house over the weekend to give me some medication that I needed to take through a shot. And that individual too was incredibly professional, made sure that I was comfortable, did all of the things she needed to do. The entire experience was just a very good experience, to say the least.
Let me talk a little bit about comfort. You'll feel the comfort right away as you walk through the door into our waiting room. You'll be greeted by a very warm receptionist who will immediately make you feel comfortable. She'll be efficient as far as getting you registered, but you're not going to have to take a number or wait in a long line. It's all very comforting when you walk in the waiting room. You won't experience any overhead pages when you're in our facility, particularly in our waiting room. And it's because we're a surgical center. We just take care of our patients. We're not a full-fledged hospital where you have other activities occurring throughout the building. You also won't be called by number when it's your turn to come through. They'll call you by your name, and all in the way of making you feel as comfortable as possible as you enter into our surgical center. You'll feel like family at our facility. We feel like family as a team of healthcare professionals, be it physicians and staff, all working together to provide the best care possible. If you have a surgical need, we hope you consider the Ambulatory Surgical Center of Stevens Point. We will provide you with skill, care, and comfort beyond your expectations, and we know you won't be disappointed.
We put the doctor right up there at the top of our list when it comes to helping us get back to normal health. The first time we took a trip to Disney, and we were both able to make it just fine on a family vacation. So we thank Doc and everybody. It was very, very good. It's just like a 5-star hotel.
The atmosphere is very homey, personal. You don't feel like a number. Everyone greets you, not just the nurse or people that are going to be treating you that day. And the size of it too is small enough to make you feel at home and comfortable.
I gotta say, this is the only place where I've ever had an IV put in where I did not feel it. It was It was a young man did it, and no matter who did it though, it was, I don't care for needles.
Again, like I say, the staff here was remarkable in making sure I was comfortable. One of the things that I did enjoy the most was the fact that I got to have them cater in my dinner that night and my breakfast the next morning. So I got to choose what it was that I wanted, and they made sure that everything was there for me. With the facility being somewhat closed at night, when my wife wanted to come and visit me, she just pressed the button at the back door and identified herself, and they came in and let her in. They were very polite and congenial to her to make sure that if she had any questions about what was going on, that they were answered. Let her stay as long as she wanted to, or as long as I needed her to stay without me falling asleep again and things. The whole experience was just a wonderful experience. I've had other surgeries done in hospitals, and I would say that this hands down was the best experience in having any type of surgery that I've ever had.
Actually, I had a dry run through here. They took me through well before the surgery, and they explained everything, showed me the facilities, actually introduced me to the nurses that would be taking care of me, and I was impressed with that. They all knew my name. They all, I had a good experience here. I mean, I don't know. I would do it again. Yeah, you really would like to avoid knee surgery if you could, but if you have to get it done, I thought that the staff and the facilities here at the ambulatory surgical center were really top notch. I tell you what, I got better personalized service than I did at the hospital. You know, consequently, you save a lot of money here. I mean, the insurance company, they saved a ton of money. I mean, I saved money, and you guys made more money because you can make some of the money in the hospital. This was a win-win for everybody, you know.
My name is Becky Ziegler Otis, and I'm the administrator of the Ambulatory Surgical Center of Stevens Point. Ambulatory surgical centers, which are sometimes referred to as ASCs, are modern healthcare facilities that are totally focused on outpatient surgery. The ASC industry overall has transformed the outpatient experience for millions of Americans by offering a convenient, personalized, lower-priced alternative to hospitals. Only about 30 years ago, all surgeries were performed in an inpatient environment, requiring long waiting periods, overnight stays, and long recovery periods. Today's ambulatory surgical centers are very patient-focused in an atmosphere that's actually removed from the distractions that are associated with running a full-service acute care facility. Today, in the United States, there's about 5,200 Medicare-certified ambulatory surgical centers across the United States, whose primary focus is on outpatient surgical care with providing excellent patient satisfaction. Quality care has been a hallmark of the ASC industry since its earliest days and remains a priority at our surgery center as well.